your guide to living with Alzheimer's disease. Have you or has someone you love recently been diagnosed with Alzheimer's disease? Or have you been living with the disease for some time? Whatever your answer may be, this video will help you better understand Alzheimer's disease. Whether you're the one who has been diagnosed with the disease or whether you're supporting someone who has been, you'll find a wealth of information here, including what to expect at the various stages of the disease and helpful advice on how to improve your day-to-day life. By deciding to watch this video, you've taken a step towards learning about the disease and how to better live with it. Your doctor is there to help you take the next critical steps, so be sure to speak to him or her regularly. Together, you'll develop the right plan for your future.
What is Alzheimer's disease? Alzheimer's disease is a type of progressive dementia, an illness of the brain that affects a person's ability to carry out daily activities. Memory, emotions, mood, behavior and language are all affected. Because the disease is progressive, the symptoms worsen over time. While there are different forms of dementia, Alzheimer's disease is the most common one among older people. Currently, there is no known cure for the disease. However, there are treatments that can help alleviate some of its symptoms, and your doctor can tell you more about them. The earlier the diagnosis, the earlier treatment can begin.
What are the first signs and symptoms? Alzheimer's disease starts slowly. In fact, when the disease begins affecting the brain, there are no outward signs or symptoms. After a while, small memory lapses appear and, over time, they grow more serious. People may forget things they used to know, like the names of familiar people or places, the words to express what they want to say, the location of everyday objects. It's normal for people to forget some things as they get older. Mild forgetfulness does not necessarily mean that it's Alzheimer's disease. People with the illness usually have a more noticeable and rapid decline in memory and other cognitive skills. If you become concerned about such changes in yourself or someone you care about, it's important to consult your physician.
Are people with Alzheimer's disease aware of their signs and symptoms? A person with Alzheimer's disease may begin to lose the ability to accurately assess their own abilities. Often, they lose insight and do not realize that they can no longer do the things they used to. That makes it particularly important to take the time to try to understand the meaning behind the behavior that the person with Alzheimer's disease may be exhibiting, and then attempt to be more empathetic in interactions with them. The types of things that they might do include denying that they have the disease, especially in the early stages, blaming or accusing others of misinterpreting their actions, being completely aware and even apologetic of their condition, "I'm sorry, but I have Alzheimer's disease," feeling frustrated, agitated or angry, not recognizing the changes in their own personality. By the middle stage, most people with Alzheimer's disease are no longer aware that they don't remember things or aren't communicating properly. But, if they are in a safe and supportive environment with regular contact with other people, most seem relatively unaffected by the disease. Watching someone decline is difficult for friends and family, though, and depression can be quite common. Fortunately, there are a host of support groups and tools out there designed to help families and friends deal with what they are experiencing.
What are the symptoms of Alzheimer's disease as it progresses? As the disease takes its course, affected people will become increasingly forgetful, and other signs will begin to show, including general confusion and disorientation of date, time, or place, apathy, irritability, depression, anxiety, problems with language, math, abstract thinking, and judgment. Personality changes and disturbing, out-of-the-ordinary behaviors. Wandering, hiding objects, problems with eating and sleeping. Later in the disease, paranoia and false beliefs may occur. Towards the end, an inability to control bodily functions occurs. These are the major symptoms, and not all people will experience all of them. It's important, however, to know what to watch for so that you can get help as it's needed.
Why is early diagnosis important? Once you recognize the signs and symptoms of Alzheimer's disease, the sooner you get a diagnosis, the better. This is true for a number of reasons. You may find that the symptoms are from another disease or condition that is curable. If, for example, the dementia is caused by a brain tumor or a vitamin deficiency, you or your loved one can get the right treatment sooner. If the diagnosis is Alzheimer's disease, you can start to speak to your loved ones about long-range planning and decision-making. The medications and lifestyle changes that slow down Alzheimer's disease work best the sooner you begin them. You can get an early start in treating the manageable symptoms that accompany the disease. You can arrange caregiving without undue pressure.
What are the stages of Alzheimer's disease? If you or a loved one have received a diagnosis of Alzheimer's disease, you may be wondering what to expect as the illness takes its course. From the time of diagnosis, people can live anywhere from 3 to 20 years, with an average of 8 years. It's helpful when planning for care to consider the illness's stages. Because Alzheimer's disease affects each person differently, people progress through the stages at different rates. And, although it's true that people with the illness will lose many of the abilities they once had, the best thing for caregivers and loved ones is to focus on the abilities that remain.
Main stages of Alzheimer's disease. The disease has the following 3 stages. 1. Mild, early stage. The person can usually function independently and may participate in their health decisions and planning for their future care despite the fact that memory loss and other cognitive deficits become noticeable. 2. Moderate, mid-stage. Mental abilities decline, personality changes, and physical problems develop, so the person becomes more dependent on caregivers. For instance, the person can still bathe, toilet and dress, although he or she might need help to do so. It is important for caregivers to give the person with the disease the chance to do as much as their remaining abilities allow them on their own. This can be done by simplifying the task at hand by dividing it into easier, smaller steps, and by maintaining the routines the person is used to. 3. Severe, late stage. Personality changes, and the loss of control over bodily functions requires total dependence on others for even the most basic activities of daily living.
What personality and cognition changes occur? In mild Alzheimer's disease, the main thing that occurs is a decline in cognition. That means that the ability to think, reason, recognize and interpret is affected. People living with the disease, as well as their family, friends, co-workers, and medical practitioners, start to notice they are struggling with communicating and logical thinking. Changes in personality, as well as idiosyncratic behaviors, begin to appear. As a result, people with the disease seem less like themselves, and so the challenge, at this point, is to try to connect with them in new ways that engage and stimulate them. A general apathy and lack of interest are characteristic of all 3 stages of the disease, but they begin here.
Mild, early stage, Alzheimer's disease. When Alzheimer's disease is diagnosed early, people's loss of abilities is often mild. With a little help, they can continue living as independently as they did before. Medications that help with the symptoms of the disease work best when begun at this early stage. Things to watch for at this stage include symptom, cognitive and memory problems that may appear. What may occur, recognizes family and friends. Can make structured sentences and express himself or herself fluently, but confuses and forgets names and words. Makes up words, or stops talking to avoid mistakes. Repeats himself or herself. Keeps on asking the same questions. May have some problems following understanding a conversation. Forgets recent events. Less able to plan, organize, or think logically. Increased difficulty with routine tasks such as planning dinner, grocery shopping, paying bills, and/or in his or her hobbies. Increasingly unable to make decisions. Defers to others' choices. Can execute basic daily activities, such as walking around and dressing, properly. Poor judgment. Decline in problem-solving skill. Disoriented about time and place. Becomes lost in non-familiar places. Has trouble concentrating and learning new things. Avoidance of change. Withdraws from social and mental challenges. Misplaces things, puts them in strange places. Symptom. Communication problems and mild forgetfulness begin. What may occur, may converse normally, but has problems finding the right words to express themselves. Able to respond to what people are saying to them, even if they have trouble keeping up with a conversation. Increasing difficulty understanding books, newspapers and other reading material. Symptom. Personality changes occur. What may occur, apathetic, withdrawn, avoids people. Anxious, suspicious, confused, fearful. Exhibits repetitive behavior. May start crying or get angry for no apparent reason.
Moderate, mid-stage, Alzheimer's disease. By the time the disease is diagnosed, it's often already in the moderate or mid-stage. That means that there's a decline in functioning, severe memory and cognitive problems, and that personality has drastically changed or even transformed. There's a marked change in people's appearance and hygiene, and, as they become less able to take care of themselves, they need considerable caregiver support. This moderate stage of the disease is the longest, and medication has proven useful to treat the symptoms of the illness throughout this stage. The range of problems that may occur include the following: symptoms: significant cognitive decline and memory problems. Distinguish familiar from unfamiliar faces, but confuses names and faces of family and friends. Know their own name, but not their address or phone number. Forgets their own history and recent events. Embarrassed by inability to remember and makes things up to compensate. Trouble comprehending things. More disorganized speaking. Mixes up words. Decreased understanding of arithmetic and money. Disoriented about the season, day of the week, time of day. Symptom: impaired communication skills. What may occur: has problems speaking in complete sentences, understanding, reading, and writing. Some sentence structure remains. Repeats words, questions, and gestures. Symptom: personality changes become more significant. What may occur: more apathetic, withdrawn, anxious, agitated. Become aggressive or threatening if they feel aggressed. In some cases, these behaviors can be caused by specific triggers or needs. Displays suspicion and paranoia, may accuse spouse of having an affair, or family members of stealing. Has hallucinations and delusions, may hear, see, smell, or taste things that aren't there. May experience an exaggeration of their normal personality traits. Symptom: idiosyncratic behaviors evolve. What may occur: exhibits inappropriate sexual behavior, may mistake another person for their spouse, may disrobe or masturbate in public. Paces, is restless, repeats movements. Wrings hands, shreds tissues, handles certain objects over and over. Wanders, sometimes away from caregivers and the familiar. Chats to self while wandering. Doesn't follow the normal sleep-wake cycle, sundowns, naps during the day, is active from late afternoon through the night. Symptom: increasing dependence and need for help with activities of daily living. What may occur: may eat without help, but needs reminding to eat and drink. Needs help dressing for the weather or occasion. May need help putting clothing onto the correct body part. Needs help with grooming, bathing, brushing teeth, combing hair. Needs help using the toilet. may no longer be safe when left alone, may fall, burn, poison, or neglect self. Needs full-time supervision for safety. Symptom: voluntary control of the body begins to decline. What may occur: incontinence increases. Can't get comfortable in a chair or on the toilet. Experiences muscle twitches.
Severe, late-stage, Alzheimer's disease. In severe or late-stage Alzheimer's disease, personality has completely changed or transformed. Cognitive symptoms get worse, and physical symptoms become more serious. This is due to the loss of brain cells in all parts of the brain. The behaviors of the earlier stages disappear, and the person may seem more subdued. Drugs used to treat the symptoms in this late stage may be useful and, if recommended by a physician, should be continued throughout this severe stage until clinical benefit is no longer demonstrated. Symptom: cognitive and memory problems further decline. What may occur: doesn't recognize familiar people, including spouse and family members. Symptom: verbal skills are nearly gone. What may occur: can no longer smile. Doesn't speak or speaks in illogical words or phrases. May call or cry out repetitively, or groan or mumble loudly. Can't write or understand reading material. Symptom: voluntary control of the body increasingly disappears. What may occur: can't control movements. Muscles are rigid. Complete urinary and bowel incontinence. Cannot walk, stand, sit up, or hold up their head without help. Falls frequently if not assisted or supported. Bedridden. Can't swallow easily. May choke on food. Can't move voluntarily. Symptom: complete dependence on others. What may occur: needs complete help with all activities of daily living. Requires full-time care. Symptom: health declines considerably. What may occur: loses weight. Reflexes are abnormal. Symptom: the body shuts down. What may occur: may refuse to eat or drink. May stop urinating. Sensory organs shut down. Exhausted, sleeps more. Symptom: personality changes. What may occur: apathetic, withdrawn, continues from mild stage. Dulling of the personality. Symptom: idiosyncratic behaviors. What may occur: may pat or touch things repeatedly. Symptom: complete dependence on others. What may occur: needs complete help with all activities of daily living. Requires full-time care.
End-of-life care and pain management. At the final stages of the disease, persons also suffer from a number of other diseases and conditions that have nothing to do with Alzheimer's disease, but that will often lead to death. For instance, pneumonia is an important cause of death among people with the disease. The main objective of end-of-life care is to alleviate pain or any distressing symptom the person is experiencing. Hence, it is important at this point, more than at any other time over the course of the disease, to provide comfort and preserve the person's dignity. All decisions regarding end-of-life care should respect the person's wishes as much as possible. If there is no advance directive, or if they have not or could not be expressed, you can take into consideration his or her beliefs and values to make a decision that would be as close as possible to the one he or she would have made. Doctors and healthcare teams are there to help decide what is best for the person, and it is important to talk to them at this stage. Keep in mind that decisions regarding end-of-life care should aim at preserving the person's dignity, privacy, and safety.
Just for caregivers. Caring for a person with Alzheimer's disease can be a difficult task that can become overwhelming at times. Each day brings new challenges as you learn how best to support your family members' changing abilities and new behaviors. As the end of life approaches, he or she may require constant care. At that point, you'll have to decide whether to hire a full-time healthcare professional to help at home, or whether it's best for your loved one to be in a facility. The guidance of a physician or a long-term care team will be needed. Try to remember that as a caregiver, you're never entirely alone. Alzheimer's disease hotlines are available for support and advice, and many organizations can provide you referrals to facilities that are affordable and close to where you live. And, of course, your local Alzheimer's Society can connect you to support groups and other community resources to help you navigate through the progression of the disease.